Hi. Today, let us see how paralysis affects our lives. According to a study done in USA, at least 1 in 50 persons is suffering with paralysis. Maybe a parent, maybe a sibling, maybe a friend, maybe a neighbor, or maybe a colleague. So that study estimated that at least 6 million people are affected by paralysis in USA. And they predicted that at least 1 crore people are suffering with paralysis in India. Actually, I think this figure is much more bigger than this. And this article was published in Lancet. I want to share a real life story of a man who received a small blow to the head followed by hemiplegia, that is paralysis of one side of the body, in the year 1990. He was admitted in a prestigious institute in Hyderabad where he was prescribed medicines. They said one of the medicine was newly launched. It gives wonderful result and it results in miraculous cures. So his son, even though it was costly, he purchased them from outside because it was not available in the institute. The cost of the medicine was, for 15 days, equal twice his son's month's salary. After receiving treatment for 15 days, there was not much change in his condition. So he was shifted to another hospital where all the possible treatments were given, but after 1 month there was hardly any change. With difficulty he was able to stand. And he endured this paralysis for about 25 years, during which time he struggled with paralysis and speech disturbances. Regrettably, in the year 2015, he passed away. And he was my father. And the only system of medicine I was knowing that time was allopathy. And I was totally depending on the advice whatever possibly doctors were giving. Myself, Dr. Sudhakar Reddy Tirupati, a pediatrician with more than 30 years of experience in modern medicine and 15 years of experience in homeopathy. I prefer to be known as a holistic practitioner rather than a specialist. I have a interesting channel, Try Incurable, on YouTube. Please try it. Please explore it. What I am going to talk, maybe your doctor may not have access to this information because it falls outside the scope of their medical training. 99.99% of specialists treating paralysis patients are unaware of these symptoms and the miraculous curative potential of these remedies because they lack the training to understand them. These drugs can be administered safely even during unconscious patient, even when the patient is in coma. I am talking about this because recently we had to treat a woman in Vizag who was unconscious after surgery. Because I knew her constitution, I requested the respected doctors to try this medicine. Just put 1 or 2 drops on the tongue. It may help her. But as expected, they turned down my request, saying that the drop can cause kidney damage. A single drop of the medicine diluted thousands of times can cause kidney damage. But because we had no option, because she was deteriorating, we had to give that medicine to that lady, just 1 or 2 drops on the tongue. Of course, without the knowledge of the doctors. 2-3 days after giving the medicine, she regained her consciousness. Today I want you to understand mainly 2 drugs which can have a miraculous effects in case of paralysis. when there is paralysis of one side, suppose one arm and one leg, we call hemiplegia. If you feel that part is cold, you touch it, if you feel that part is cold, then you can safely give a medicine known as causticum. It does miracles in such cases. In the year 2015, a woman aged around 70 years in a remote village, she developed paralysis on the day when her husband died. I noticed coldness of one side of the limb, that was paralyzed side. Even though in the remote village, I always carry my repertory book and a homeopathy kit. We did not disclose to anyone. I told this thing only to her son, that she is paralyzed. Let us try treatment. So I started giving causticum 30 ch, 6 pellets diluted in 250 ml of water, 1 ml every hour. After 2-3 hours, the paralyzed side started becoming warm. Then in 24 hours, she was ambulatory, she was able to walk. And when we disclosed this to their relatives, none of them believed us that she had an attack of paralysis. That is the effect of, that is the power of spiritual medicine. And the woman who recovered from paralysis was my mother. The only difference was when my father was paralyzed, I was helpless, I was depending on the advice of doctors. But when my mother was paralyzed, I was able to help her in recovering within 24 hours. So this is about coldness of the part, paralyzed part. When there is heat in the paralyzed part, if you find the paralyzed part is hot, then a medicine known as phosphorus does wonders. So by following this straightforward and simple method, we can potentially reverse paralysis by at least 25 to 50% within first 6 hours, possibly first 24 hours. These two important remedies can reverse paralysis, can reduce patient suffering, can reduce the severity of final deformity, can avoid or reduce hospital stay, and can help in substantial cost savings. The indication for causticum, if along with the coldness of the paralyzed part, please understand it very carefully, along with the coldness of the paralyzed part, if the following indications are there, the indications become more stronger, means it is likely to act more effectively. What are they? If there is a speech impairment, if there is numbness of the paralyzed side, and if the paralysis happens on the right side, and the paralysis slowly advancing, and paralysis after becoming wet. Suppose somebody is wet or fell into water or near drowning, then paralysis stopped rotting. After that, this medicine causticum does wonders. And phosphorus also, the role becomes more stronger if along with the heat of the paralyzed spot, if there are convulsions of the paralyzed spot, or involuntary movements of the paralyzed spots, or formication, means they have the feeling of as if ants are crawling, worms are crawling. And if the paralysis follows stroke, then indications for phosphorus becomes very stronger. So what is stroke? Stroke occurs when the supply of blood to the brain is reduced or blocked completely. So let us understand two drugs which can dissolve blood clots. After head injury, if there is a concussion means something like a shock to the brain, usually follows after a blow to the head, which is usually temporary. During that time, there may be headache, there may be memory disturbances, there may be coordination problem, and there may be mental changes. Very brief period, that is concussion. Or in hematoma of brain, we commonly hear that there is a bleeding in the brain at various levels, wherever it is hematoma, intracranial bleeding. Or If there are convulsions or fits after head injury, or there is pain after head injury, the two medicines, remember two medicines which does wonders are arnica montana and natrum sulfuricum. And the indications for natrum sulfuricum becomes more stronger if mental function is altered or if there is vertigo, a sensation of falling or giddiness after the head injury. One of my relative met with road accident recently, about 6 months back. He was unconscious after that, and he was admitted in a famous neuro center in the Hyderabad, that's what they call. There was a fracture of the frontal bone and there was intracranial bleeding. They gave all the possible treatments for about 3 weeks. After 3 weeks also, there was not much change in his condition. He used to come to consciousness, in between again go back to coma. There was a lot of disturbance, memory disturbance. After 3 weeks, hospital bill was about 10 lakhs. Unable to bear the expenditure, they brought him to the home. And they consulted me after 1 month. It was too late, but even then I gave the medicine. After that, there was slight improvement in his condition, but ultimately he is disabled mentally because treatment was started late. He lost his money, he lost his health. He is depending on his daughter for survival, along with his wife, who is also paralytic, who is also paralyzed. I want you to understand with little attention what is done in hospitals. There are few drugs, what we give in case of stroke. There are medicines to break the existing blood clots, or medicines are given to prevent formation of blood clots, known as blood thinners or anticoagulants and antiplatelet drugs. But whatever they are, there is an indication of, there is a risk of bleeding after using them. That is about the drugs. Then coming to the blood clot in the brain, hematoma. Let us see what treatment usually they give. If hematoma is small, it need not be removed. But signs and symptoms can appear and worsen over days or weeks. And intracranial pressure need to be monitored, and they may need repeated CT scans. Only conservative treatment is given. Or they may be given blood thinners. But you may need a therapy to reverse the effect of blood thinners after that. This is about conservative management. Let us understand few things about surgery. If the hematoma is small, they put a small hole in the skull and suction or remove whatever the blood is there, which is liquefied, what is known as surgical drainage. The other procedure is craniotomy. When the hematoma is big, a part of the skull is opened and they remove the hematoma. Then let us see the recovery after intracranial, after the surgery. Recovery can take long time, maximum recovery in 3 months, not beyond that. Our patient may not recover. So help them, helplessly waiting in altered state of mind, in coma, with 2 drugs which can resolve the blood clots. They are arnica and natrum sulfuricum without the risk of bleeding. And there are 2 drugs. They can reverse the paralysis. Remember, causticum and phosphorus. Patients, relatives will be waiting eagerly outside for days or weeks together, hoping something good will happen. But if these 2 medicines are given along with whatever procedures they do in the hospitals, at least 25 to 50% of the problems can be solved. Share and help this. Share this and help others. This schedule can prevent many disabilities and unnecessary suffering, need for unnecessary hospitalizations. This can shorten the duration of illness, and there can be substantial cost savings, which plays a major role these days. It provides a safe and effective and good chance of recovery, free from any side effects, can be administered even in coma. Another relative of mine underwent a surgery for kidney stone removal in prestigious institute in Hyderabad. After recovering from anesthesia, he noticed that one side of his body was paralyzed. They treated in all possible ways for about 5 days. Then they requested me to come and see. I saw him on 6th day. I gave the medicine. He was discharged 3 days after that because there was a 90% improvement in his condition, even though he has some difficulty in walking, little difficulty, and little incoherent speech. Finally, my intention is to make things simple for common man. For me to do that, I need your help in the form of subscription and sharing. Please help people waiting there in altered state of mind or coma with these two drugs which can have a miraculous effect. Please wait for my upcoming video, how to save yourself from heart attack, prevent its progress wherever you are with 2 simple techniques. I think to talk about paralysis, I personally feel that there is no better person than me because my parents experienced, my father experienced it in 1990 when I was helpless. He suffered for 25 years. But same thing in the year 2015 when my mother suffered with paralysis. I had the help of the medicines, miraculous medicines. She was able to walk in 24 hours. So I have seen both the things. So please spread this information. Thank you very much for your time.